this is the third installment for Trans for Doctors. So far we've learned what being trans is, how trans people have been mystery in the past. Let's talk about how to rectify that. I've experienced this myself. I've asked a set of medical professionals, who shall remain nameless, to refer me to a gender clinic in the past, yet failed to make that referral for a year, and then finally one of yours, a GP, called them out for not doing so. To say me and the GP were distraught is an understatement. If you have one takeaway from these series of videos, it's really important you build trust and keep that trust in person. Many trans people go from service to service that promises to help them, yet completely fails at it. If you're going to perform a specific action to help them, be realistic with the individual how the path is going to look in terms of supporting them. Note, I didn't say treatment there, because inherently there's nothing wrong with trans people. Remember that. Repeated negative experiences where people have to retell the story over and over again and suffer discrimination as well can lead to what's called a re-traumatization, where they may have already faced extreme challenges in transitioning and negative experiences with the medical community in general, and then doctors wonder, why don't they come to us? Please, please, please do not let that happen, because at that point your options for helping people are very limited, because it's a lot harder to get back into this person will accept you. Something that every medical professional can do is to use active listening skills. That is actually genuinely hearing the person out, not interrupting them, just letting them say something and asking questions that are appropriate. It's really important to do that, as your experiences may not match the experiences of the other person, even if you're a trans or non-binary GP themselves. Some people, again, may seek medication, some may seek surgery, some may not. And some, like myself, will look like fashion disasters when they start. That's okay. They probably won't appear as what they want to be in the future. But that's okay at that stage. Not every person will be comfortable doing a 180 on their life and going up against everything they've known and the societal norms that they know instantly. Finally, it's important that you build a working relationship. You shouldn't be, a sort of patient or doctor, really. The best way to do it is through just treating people as people. Naturally, that means still keeping those professional boundaries that all doctors have, but the idea is that they're humans. Being trans is hardly contagious. I understand that in 10-minute GP appointments that might be difficult, and there are huge time pressures on GPs, especially with how the NHS is right now. Which is why, whenever possible, try and book like double appointments and stuff, because some people will need that. There'll be a lot of pent-up emotion, and people will just need to talk about things to you. That's all the advice that applies for every trans and non-binary encounter that you may have in your office. Whether that's for an unrelated issue, or if to ask for help in transitioning. In the next video, we'll talk about specific advice about transitioning, what it is, and what options there are for medical treatment.